for you that goes over food allergy, food intolerance, the ALCAT testing methodology. We're going to discuss ALCAT versus IgG testing for food sensitivity. We're also going to review who should be tested, who are the candidates for testing, what conditions should you be looking for in your practice. We're going to do a short review of the test results, shipping and handling, drug interactions, and at the very end we'll do a Q&A for everyone to go over your questions. So let's get started. Dr. Blum, hit it.
Good evening. As Lee said, we're going to be talking about the differences between allergy testing and food intolerance testing. In allergy testing, we're talking about IgG and IgE specific testing. IgE is the type of response that one gets when one eats peanuts or shellfish and has a immediate reaction that may be as mild as a rash or diarrhea, or as severe as a life-threatening reaction, and that is detected through IgE testing. IgG testing is a mediated test, a mediated test that is done on foods through an ELISA-like test through sera, and gives you information about the exposure through titers. So it gives you information about how much a given food has been eaten over the past couple days to weeks, and will give you information about the sensitivity of that food for short reactions. What we're testing in ALCAT is a delayed sensitivity type 4 reaction that is responsible for inflammatory disease markers and leading to autoimmune diseases. So the type of things that we're looking at are, if you follow along inflammatory disease to autoimmune diseases, those are the type of conditions that our testing is most responsible for as we look at food intolerance. I don't know. No, move. Okay. Obviously, this diagram talks about sort of skin reactions, digestive upsets, headaches, migraines, the type of conditions that we see with the autoimmune and chronic inflammatory disease range from diabetes to heart disease, arthritis, inflammatory bowel disease, migraines, heart disease, and so forth. The ALCAT test is more effective than the IgG, as I've said, because it relies the IgG relies exclusively on one immune pathway, whereas the ALCAT is a more comprehensive approach. Next.
Well, I think, go back for a second. I think the one thing we need to take away from this slide, and this is Lee Rolnick speaking, is that many of the practitioners we work with, when we first come in contact with them, they understand the importance of doing food sensitivity testing as opposed to food allergy testing, but many of them are using one of the more popular IgG labs that are available out in the marketplace. We understand that IgG testing is widely done and is the industry standard for sensitivity testing. What we have here at the ALCAT test is a cell-related or a cell-mediated test. What we're looking at is cellular reaction as opposed to titer levels of immunoglobulin G. What you get, and what we've heard in our feedback from physicians, is that the IgG levels or the titer levels of immunoglobulin G rise and fall with the patient's frequency of consumption of those foods. So the test is what we call exposure dependent. If there's no exposure, even in a celiac patient, if you take someone who's severely sensitive to gluten, take them off gluten for 6 months, do an IgG test, they will show up negative to gluten when it's quite clear that they have a severe reaction to gluten. The ALCAT test is not dependent upon exposure and can even pick up reactions which are genetic. And therein lies the major, major difference between ALCAT and IgG testing. Go ahead, Jim. Go ahead, Jim.
Let's talk about a healthy gut. In a healthy gut, we have a good microflora going on, needed to maintain the immune function, repair, and detox. Adequate digestive enzymes and a pH are required, as intact intestinal epithelial barrier, or what we call a leaky gut. And there is an autonomic function relating to the gut that we tend to forget about. The gut has its own nervous system, and that function is critical or crucial to good digestive function. In an unhealthy gut system, we have poor diet, medications on board, we have infection, toxins, and the toxins range from heavy metals, molds, pesticides, household chemicals. Now, when we talk about the leaky gut needs to be repaired as you do the elimination diet, but ultimately what you have to look for is to get rid of the toxins, detoxify the gut in order to shut down the leaky gut, so that ultimately, if you don't do that, we'll have problems.
Keep going.
We have inadequate enzyme production, an unbalanced or dysfunctional dysbiosis flora ecology, impaired gut permeability or the leaky gut, and an altered autonomic function. Next. Why should we focus on the gut when we talk about functional medicine? 70% of all Americans have gut symptoms or some sort of gut disease. It is the most sensitive organ to insults, resulting in common dysfunction. The most efficient clinical outcomes across all disease spectrum results from normalization of the gut. So that's why we need to think about the gut. Do we have a question?
Can I answer that question after? Okay. I mean, the answer to the question is because you've healed the gut. If results aren't, there's a question that just came up, and I know we said we would take the questions at the very end, but I think it's important to take this one now. The question that came up is, if results aren't exposure dependent, then why do sensitivities get better with avoidance? My answer to that would be, once you heal the gut and reintroduce those foods, once you take those foods out of your diet for 6 months, 9 months, what you're doing is you're healing the gut. And at that point, you can put those foods back into the person's diet on a rotation basis, and symptoms will be lessened, or the sensitivities will get better. It's avoidance combined with healing of the gut. It's not simply the avoidance. The avoidance gives you time to heal the gut. It takes the offending foods that are causing gut irritation or gut permeability out of the person's diet. So avoidance, healthy gut, reintroduction is essentially the ALCAT plan.
Now, some foods will never be okay. There are going to be certain foods that are genetically predispositioned to problems, so that even if you repeat the ALCAT test 1, 2, and 3 years later, there may be 1 or 2 or possibly 3 foods that will always be positive, because there's a genetic component to making them sensitive to any given individual. As Lee was talking about the leaky gut.
Well, we have some slides on that, so let's go.
Okay, yeah.
The next slides that are coming up.
All right, thanks.
There you go.
All right, the example of the leaky gut. The leaky gut is basically an increased permeability across the gut lumen from undigested food proteins and glycoproteins that haven't gotten down to the amino acid size. So they, because of the toxins and other triggers to form the leaky gut, they cross the barrier, and on the other side of that barrier are immune cells. And those immune cells mount a reaction just as if it was a parasite or bacteria or virus, and set off a cascade that produces an inflammatory response. If you take the same food day after day or week after week, that chronic or that temporary inflammatory response becomes chronic. As we eat the same foods month after month and year after year, you'll get a chronic inflammatory response leading to an autoimmune condition that we will put into a category. So at some point, you've joined the club. You now have rheumatoid arthritis. You now have diabetes. You now have whatever disease you want to call it, but you're now in the club. Okay, so that's what's going on with the leaky gut. In 2007, 21 million adults and children in the United States were suffering from diabetes. 64% of adults were overweight or obese. This epidemic is caused by the low-grade inflammatory response resulting from the chronic activation of the innate immune system, also causing a large number of other chronic diseases, some that are listed here and some will be displayed later. Next. Modern research is showing that 95% of all chronic disease has an inflammatory component, and now that list includes certain types of breast cancer, heart disease, and other diseases that weren't considered inflammatory are now have hit that category in the last 5 to 10 years. The ALCAT food sensitivity testing can help to determine on an individual basis a unique anti-inflammatory diet which can be used for weight management, obesity, diabetes, and all these other health concerns. We present biological, in an article that was published by Duncan, we present biological evidence to suggest that chronic activation of the innate immune system may underlie the metabolic syndrome characterizing the common soil for the causality of type 2 diabetes and cardiovascular disease. About cell science systems, Mr. Rolnick.
I'm going to give you a little background about our company, and then we'll go into some of the shipping procedures and other sales and marketing related issues. Cell Science Systems, we offer the ALCAT test, and we're a privately held U.S.-based biomedical lab. We've been in business for 24 years offering the ALCAT test, and the ALCAT test is done off of a proprietary device that we build here on site. We are an FDA registered and inspected device manufacturer. Our device is ISO certified. Our laboratory is CLIA inspected and licensed, and we also have satellite laboratories in 20 countries across 6 continents. So the test is truly a worldwide entity and you can get this test almost anywhere in the United States and anywhere in the world. The ALCAT test, again, as Dr. Blum has stated, is a whole blood test as opposed to testing serum. We measure the cell reactions of a patient's white blood cells, their neutrophils, before and after introduction to as many as 300 plus antigens. So the things that we're currently screening or testing for are 200 foods, food additives and food colorings, common molds, environmental chemicals, and we've just released a new panel for functional foods and medicinal herbs. The machine itself, again, is CE marked for the European Union and TÜV certified and safety monitored. So there are standards that we need to stick with when we're creating these machines. This machine, this RoboCat analyzer, is really the bread and butter of our company and what separates us from all the other laboratories that claim to do food sensitivity testing. We're looking at cellular reactions. They're looking at antibody levels. We are the only company that manufactures the RoboCat machine. We are the only company that produces and uses this technology. What is the ALCAT test? The ALCAT test is a whole blood test that detects food and chemical triggers of the innate immune system. These triggers will cause neutrophil activation. When our neutrophils, the defenders of our body, come in contact with toxins, they release harmful mediators in an attempt to kill those toxins. The problem we run into is many people have these undigested food proteins resulting from some level of leaky gut, whether it's full-blown leaky gut or just some intestinal permeability. Those food proteins are making it into the bloodstream. When they make it into the bloodstream, they come in contact with our white blood cells. At that point, our white blood cells attack the undigested food proteins. Dan, can you close that for me, please? Our ALCAT machine measures the changes in the size and volume of the neutrophils. Sensitivities, as we've learned, and intolerances are not IgE mediated. So what you're going to want to do is a delayed sensitivity test. Here's an indication, or here's a graphic that shows you cellular degranulation, the type of thing that we're measuring with the ALCAT test. On the left side, on the bottom, you'll see a neutrophil being activated. On the right side, you'll see that very same neutrophil releasing the free radicals, releasing the harmful mediators that basically destroy the toxin that it's coming in contact with. So we're measuring the degranulation of that cell. If nothing happens and the cell is not activated, we tell you that's okay. That food or that substance, you're not having a cellular reaction. You're not unnecessarily stimulating your immune system. Okay, the testing process itself. What we do is we combine the blood with a food, chemical, or mold test agent. We allow time for the pathway to trigger. We allow time for a cellular reaction. That is then loaded into our analyzer where the white blood cell size and volume changes are measured. We create a baseline or distribution curve, and we compare that, we create a baseline curve and we compare the volume distribution curve against that baseline. We report the difference between those two areas as our high, moderate, and mild reactions. Here's an example on the right side of what those graphs or what the test results look like behind the scenes, if you will. What you see on the left side is the patient's non-reactive sample. So if the baseline is the dotted line and the distribution curve is the second line, we measure the difference between those two curves. Here's a study that was done at Baylor Medical College that details the success rate that the ALCAT has with patients who have the inability to lose weight. What they did was they tested 100 patients. 50 of them did their own form of weight loss. The other 50 did the ALCAT test and simply followed the ALCAT test results, which were an eat this, don't eat this test result. 98% of the patients who followed the ALCAT plan lost weight or improved their body composition, thus proving that the ALCAT test is an effective method for weight control. What type of practitioners or what type of healthcare providers currently are offering the ALCAT test? It's a wide-ranging group of healthcare providers, as we can see just by the attendees in the webinar tonight. We have medical doctors, MDs, we have naturopathic physicians, osteopathic physicians, nutritionists, dietitians. It really boils down to anybody that has a focus on nutrition on any level in their practice would be a great fit for this type of testing. So who should we test? Who's a good candidate for the ALCAT test? Who should I be looking for in my patient base in terms of testing for the ALCAT? Well, you're going to be looking for people that suffer from one or more clinical symptoms, things like inability to lose weight, things like arthritis, diabetes, skin disorders, gastrointestinal issues. But also we're looking at athletes who can improve performance and accelerate recovery time. We work with a lot of nutritionists, dietitians, medical doctors who see professional athletes who've used the ALCAT, for lack of a better word, to take it to the next level. We like to think that anyone, whether sick or healthy, can really benefit from the ALCAT test because it provides an eating plan. It provides a roadmap for a healthy lifestyle. It's not a quick fix. It's not a temporary solution. It's not prepackaged foods. It's really an eating plan that can be applied for the rest of this patient's life. And here's a stat for you on the bottom that food sensitivities and food intolerances affect 80% of the population, while less than 5% of the population have a true food allergy. The problem we see here is that if your symptoms are hours and days after the consumption of the food, many times people have a hard time linking that back to the things they ate hours and days previous. We'll go over that. Here are some of the conditions that we've identified that we, through the years, have helped people with, conditions linked to inflammation and or chronic activation of your immune system. I think that many of you are seeing these type of conditions that walk through your practice every single day. We know that food-related issues cause gastrointestinal problems, but we should also be looking for things like hyperactivity and attention deficit, chronic fatigue, all the respiratory disorders, even things like skin disorders, eczema and psoriasis have a tremendous inflammatory component that can be helped by the ALCAT test. Jim, did you want to add anything on that?
No.
Okay. We're quickly going to go over the test results for you. This is many of you who are already clients of ours have seen these test results. They're very easy to understand. They're designed to be very user-friendly. The 4 categories you'll see are green, which are the foods that are non-reactive. These are the healthy foods or the acceptable foods for the patient. And then the reactive foods are grouped into 3 distinct groups. A highly severe, which we'll ask you to remove from your diet for 6 to 9 months. Moderately severe, which we'll ask you to take out of your diet for 6 months. And then mild or equivocal, which we're going to have you avoid if at all possible. One of the benefits of testing with the lab is that you get a nice, robust results package that we send out to the patients. We send it actually to the doctors to give to the patients, and it includes a 35-page booklet that comes free with every test result. And that booklet goes into detail. It explains the test results, explains to the patients all the components of gluten, casein, whey, all the different components of that. It goes over all the food additives, food colorings, the molds. It gives nutritional guidelines, cooking tips, information on vitamins, minerals, supplements. So it's a very helpful guide for anyone, whether you've taken the ALCAT test or not. It's a very helpful nutrition guide, if you will. And that comes free with every test that you take. Also available on our website. One of the good features of being a customer of the ALCAT laboratories is not only do we turn around your test results and we'll have them at your door in 10 business days, but we'll also upload them to a secure server. If you'll notice, on the left side is our home page, and the left side of the left picture, you will see a practitioner login. When you do your first test with us, we'll give you a username and password where you can actually access a PDF copy of all of your patient's test results that lie on a secure server. So you can go in there at any time and download any of your patient's test results. Those results are available for printing 3 business days after we receive a sample. So we think, and we'd like to believe, that we have the quickest turnaround times and the best customer service in the industry, and this is an example of that. Here's a new program for us that for any practitioner that does not staff a dietitian or a nutritionist, this would be a very, very helpful addition to the ALCAT testing in your practice. What we call it is our Nutritional Compliance Program. And what it's, again, designed to do is almost to take the place of a nutritionist in your practice. You can test your patients with ALCAT, and you can enroll them in our very own Nutritional Compliance Program run by Dr. Blum and his team of nutritionists. What they do for the patient is they create customized meal plans and recipes for the patient, and they enroll them in a consultation program that is consultations over the course of 6 months that is designed to aid in compliance and reintroduction of their reactive foods. So essentially, we'll hold their hand through the entire food removal, food reintroduction process, and we'll make it a lot easier for them by providing encouragement as well as meal plans and other helpful items in that program. I'm going to go over the shipping process really quickly, just so everyone understands how to ship and how we get this right. Yes, right now your ALCAT testing kit has 3 tubes. If you guys have them on your shelves, it's 3 tubes. We're moving now towards 4 tubes with our addition to functional foods and medicinal herbs. We're going to need an extra vial of blood, but don't worry, they're very small vials of blood. So your kit will contain either 3 or 4 blue top vials, a biohazard bag, the requisition form, which tells us who's the doctor and who's the patient and what test are we running. The kit also includes shipping and collection instructions. So what you're going to do, we have two distinct kits, a Monday through Thursday draw kit as well as a Friday only draw kit. So if you're a practitioner that would like to draw blood on Friday, you can request from your customer service rep or from your ALCAT sales rep Friday draw kits. They look exactly the same as our Monday through Thursday draw kits, but they have a sticker on the front that says Friday draw only. You're going to fill out the CSS requisition form that tells us which test panel you'd like to run on that patient, as well as the patient's name, date of birth, etc. You're going to place the vials and the form into the box provided, place the box into the prepaid Federal Express clinical pack that comes in every single test kit, and you're just going to call 1-800-GO-FedEx for an express pickup for overnight delivery. The prepaid packages, we pay those. They have a stamp on them already. Again, very important, there's no spinning, no refrigerating, no fasting. This is a whole blood test that must be delivered to our laboratory the very next day after that blood is drawn. So please, no spinning, no refrigerating, as well as no drop box. It's very important that you actually call 1-800-GO-FedEx and have them come pick it up. There is no charge for that. We don't want you to leave it in a drop box just in case you miss the local cutoff time. We don't want that to sit in the drop box overnight. Drug interactions, I'm going to let Dr. Blum handle this. There are a few things that you're going to want your patients to avoid prior to testing. These things do have an effect on a patient's white blood cell count, which is really the key to us being able to run the test. So Dr. Blum, you want to walk them through this?
Sure. Thanks. The most significant problems that we have are with patients that are on a dose of prednisone, and so we would like the dose, if you're tapering down on the prednisone dose, to have it come all the way down to about 5 milligrams or less, and have it stable at that rate for a couple days. Or if they're coming off of it, come all the way off of it for about 2 days, 2 to 3 days, and then do the ALCAT testing. And the same is true for antihistamines. If somebody's taking Benadryl or cold medicine, have them come off of it for a couple days before they do the testing. Another problem is high-dose vitamin C. We'd like to have it reduced to 0.5 gram a day for 3 days. And those are the major drug interactions that we have issues with for our testing. So if you can keep within those guidelines, that's great. If you have questions, give me a call. I have a direct number here at the company and can answer your questions pretty easily, or somebody on my staff can.
Okay, that's it.
So, folks, if you have any questions, we'd really appreciate you writing them into the chat box. Looks like there's a couple here, or at least write that you do have a question. We'll try to answer as many of these as possible. We're going to go to the top real quick in our chat box. Yes, these slides will be available after the presentation. We'll try to get them up on the website in the next day or so. Your representative will also be able to send them out to you. Looks like the first question comes from Lisa.
We answered that one already.
Campbell. Yep. Looks like we have already answered that question.
Well, hold on. Unmute them. And let's ask Lisa if we satisfy her with our answer. Is Lisa there?
Yeah, Lisa, we're going to unmute you real quick.
There's Lisa. Lisa, can you hear us?
Yes.
Lisa, did my answer, did that satisfy your question when you were asking about exposure-related, why do they get better with avoidance? Did my answer?
Yeah, we need to just get stronger on healing the gut.
Well, it's the avoidance gives the gut a chance to heal, and then unlike a true food allergy, we're going to put those foods back in, but only on a rotation basis. So you may not be able to handle corn in an unhealthy gut, but you may be able to have it once every 5 days in what we'll call a healthy gut. Does that make sense?
Sure.
Okay, great. Cool. And Lisa, if you have any additional questions that we didn't cover here, you can always call Dr. Blum or I offline or after the meeting. We'd be happy to discuss that with you.
All right, thank you.
You're very welcome.
So the next question comes from Barbara Allen, and this is a question that she often gets from her patients. So I'm going to unmute Barbara Allen real quick. Let's find it. One moment. Barbara, are you here?
Yes, I am. So the basic question is, and they're always quoting some expert-sounding body that I've never heard before with some obscure website somewhere saying that the ALCAT test isn't reproducible or the results aren't valid. And I'm just wondering how you would suggest handling that question.
Sure. Well, the first thing, I think Jim and I will both answer it. We'll give you both our perspectives on that. First, I would look for the source of who's publishing that information. Very often when we dig through that information, we find that it's sponsored or, these studies are paid for by another laboratory. So that loses a little bit of its luster or credibility at that point. Our test is very, very reproducible if done properly. It's not an IgG test that you're going to get the same result as long as the patient doesn't modify their diet. There are a few factors that affect the reproducibility of the test. One being how long between the blood being drawn and the blood being run here at our laboratory. So if Federal Express doesn't do their job and it doesn't come to our laboratory within 24 hours, we're unable to run that sample. Temperature is another factor that affects the blood testing. But if the patients are drawn on the same day, under the same conditions, and shipped to our laboratory, we should see close to a 90% reproducibility rate, and we have several studies, recent and older, that will support that. That if anybody would like to see those studies, they're both on our website, and I'd be happy to email them directly to you. When compared to an IgG test, that's sort of what's used to poke holes in ALCAT is that, well, it's not reproducible, it's not reproducible. It's very, very, very reproducible. And we can send you protocols, and you can test us on our reproducibility. We invite you to do that.
A couple of things that the ALCAT company has been doing in the last couple of years to improve the reliability is we've built a better RoboCat. In the last 6 months, 9 months, the chief engineer here has redesigned some of the circuit boards, the motherboard, if you will, to get better noise reduction and a better set of results. So the actual board machinery is functioning at a much higher level, and that's one whole series of projects. And then we've undertaken a lot of work to get our antigens more stable and more reproducible from batch to batch, so that the cassettes that we run the blood on is populated with different food antigens, and that whole process has undergone great scrutiny to improve the reliability and reproducibility of those antigens into the cassettes. So we've taken on some major projects to look at our own reproducibility. Our goal is to get upwards of 95% reproducibility with the test, a goal that we hope to have done in later this year. I want to remind everybody that no lab test is 100%. So even if you look at a glucose, a serum glucose, and you get a recording or reading of 110, what's the standard deviation around that level? And nothing is, 110 is not 110. It's 107 to 113. So that anywhere in that you can understand some of the testing issues. Next question, Dan.
So the next one would be, please, Barbara, does that satisfy your question?
Yes, thank you very much.
Barbara, do you want me to send you some, it's Lee again, did you want me to send you some of those studies that you can show either your patients or whoever's questioning you on that?
That would be fantastic if I could just attach those to my answers when
I'd be happy to. And I can even send you the protocol for reproducibility in case anyone wants to test us on that. Barbara, okay. I would like people to judge us not just on our reproducibility, but on our clinical outcomes. Because I think a combination of both is what you should be using to judge your laboratories. We're by far the best lab out there with clinical outcomes, and we're really, really, really good at reproducibility. But if you judge us on only one, you're missing half the picture. And I think a combination of both is a good judge of a good lab.
Yeah, well, that's usually what I focus on in the answer is I can't tell you what this board was doing or why they said that. I just know the outcomes I get with my patients.
Yeah, well, Barbara, you as someone, I mean, I don't know if everyone in the room knows you. You've been using our lab for quite some time, so you're not, you know, here to just kind of poke around. You've been using the laboratory, and you've seen these positive outcomes in your own patients.
Yes, I have. You know, I'm probably as close as you get to a true believer, just because patient after patient after patient, it makes such a big difference.
Barbara, we really appreciate that, and thank you for being a supporter of the laboratory. We have Roger Deutsch here, who's the CEO and owner of our company, who wanted to just make a quick comment regarding that. I'm going to turn it over to Roger. Roger?
Yeah.
Roger?
Hi, everyone. Just in response to your question about the Australasian Allergy Society, I actually went over to Australia in 1993 with one of the head technicians here, and we did a reproducibility study at one of the hospitals. And then we actually had a really excellent outcome, but they reported it as not being a good outcome. And, you know, there's probably a lot of political reasons why in the past some people have looked at ALCAT as a potential competitor. We're not, in my view, 100% objective about reporting about it. And sometimes we'd see publications which would cite other publications. And in publication A, it would be the author expressing his opinion. And then he would support his opinion on the basis of publication B. And if you went to publication B, you saw the same author just expressing an opinion. And then it was a little bit of smoke and mirrors. It suddenly becomes looking like a fact. So that's all changing now, because there's no reason why people who are involved in allergy testing need to exclude sensitivity testing, because they're both compatible. And I think, you know, at long last, after many, many years, that's beginning to be recognized, and the doors are opening up a little bit. So I don't know if that explanation helps, but sometimes new ideas in science or new ideas in medicine just take time to get hold, and the initial reaction is to resist it. So.
Thank you, Roger. Our next question comes from Sarah. Yes. And the question is, please stress that if a patient's white blood cell count is low, the test will not work. Well, it's not that the test won't work, it's that we reject the sample. There is a minimum white cell count that must be achieved for us to run the sample. So if we have issues with temperature, with time out of the body, with a drug interaction, and that cell count is too low, we're going to have to reject that sample and ask that it be redrawn. Now, as a practitioner, you won't be charged for that. We'll simply send you a new test kit to do the redraw. We'd rather reject the sample than send out a less than viable result. Sarah, does that answer your question, or did you want to add anything? Oh, Sarah's muted. Unmute Sarah.
There we go, Sarah.
I accidentally hung up when I tried to unmute my phone, so sorry about that.
That's quite all right. Sarah, is that essentially, I mean, you're saying...
I didn't hear anything you said because I left, but I just have worked with competitor testing companies, and one of the things that I know better to do with my patients now is to actually run a CBC on them, because, you know, if you don't know ahead of time that their white blood cells are low, the test doesn't occur. It doesn't perform the way that it should. So I just wanted to stress that with other people. So I don't know what you guys said in regards to that, but that was my experience with other lab tests.
Absolutely. And yes, I mean, it's quite clear that the white blood cell count does have an effect on the test. There is a minimum threshold when the sample arrives that we need to achieve to actually run the testing. So things like temperature and time do affect that. So we want to make sure that people have a high enough cell count and that we're reporting a viable, guys, absolutely not. We want to make sure that we're recording a viable sample and sending that out. Again, you won't be charged if a sample comes in and it is not, it falls below that threshold. Well, all we'll do is send you out another test kit. Jim, did you want to add anything on that?
No.
Okay. The next question is, what does vitamin C have on the test? What effect does vitamin C have on the test result? Jim, vitamin C?
It's inhibitory to the cellular response if there's too much vitamin C on board. That's why we requested it be less than half a gram a day.
Okay, so the test result wouldn't be accurate because you wouldn't pick up the true sensitivities.
It may not be. There may be certain foods that escape detection on the severity.
Okay, thank you.
Also, quercetin is also going to be inhibitory to the cellular response.
Okay.
Kathy, does that answer your question?
Yeah, I just wanted to know, if someone said, oh, I didn't look at the directions and I was taking 1,000 milligrams of vitamin C and I sent my results in, what's going to happen? I wanted to be clear on what to be able to tell them.
Probably a gram a day is fine. What we really want to avoid is the patient with, 2 to 3 grams a day on board. At that point, it's going to be really a problem, potentially a problem. Somewhere between a half a gram and a gram I would not bother with.
Okay, thank you.
Thank you, Kathy.
Yep.
Looks like the next question is again from Barbara Allen. I'm going to go ahead and unmute you again. 1 second. What's your question? So, Barbara, if you want to go ahead and ask the question.
Okay. I'm having to remember exactly what I asked. Could you remind me?
How do the blue category food reactions compare to the red, orange, yellow severity levels?
Yeah, so I get that asked really very often. So if it's mild, moderate, or high or severe, does that correspond to the red, orange, yellow levels, or is it in its own scale somehow?
No, it absolutely responds to the red, yellow, and orange scale. What we do with the blue boxes is we feel that it's very important to take things like candida, gluten, casein, and whey. I think these involve a separate conversation from, don't eat tomatoes or don't eat corn. Mm-hmm. Because there's associated reactions. Obviously, if someone is gluten sensitive, we take them off barley, we take them off oat. So that blue box is essentially an area for us to pull in the associated reactions. So, you're reactive to, like I said, gluten, we don't want you to eat oat. But the mild, moderate, and severe is the exact same thing as the red, the yellow, and the orange. It's the very same thing, but those boxes are used for associated reactions, additional foods that need to be taken out of the diet because of the reaction to casein, whey, gluten, etc.
Wonderful.
Does that answer the question, Barbara?
Yes, it does.
Okay. Thanks again, Barbara. So, explain sensitivity to cow's milk, but not whey or casein. Jim, you want to handle that?
Sure. Cow's milk is more than just casein and whey, so there are going to be enzymes and other components of cow's milk that that a given patient may be reacting to. So it's a homogeneous group of substances, and one or more of those may be causing the reaction to cow's milk.
So if someone does not respond to casein or whey, they could use like a whey powder, but they couldn't drink cow's milk?
Yes, if they're non-reactive to the whey or casein, yes, they can use a whey powder for protein.
And then what about cheese? In the booklet, it talks a little bit about cheese and how, maybe someone is sensitive to cow's milk but not cheese. But sometimes I don't see cheese show up at all.
Well, cheese is generally a fermented product and avoid some of those issues. Are we talking Vermont cheese or Wisconsin cheese?
Well, in a test I did recently, it was the full platinum test. Cheese was not listed on anything, green, red, orange. It just
right. We don't test cheese because of the problem with what I just mentioned. Where does it come from? what kind of cheese is it? You know, you can run hundreds of different kinds of cheeses. So we would run into a very difficult scenario. It's the same question why we don't test yogurt, because there are so many kinds of cheese, so many kinds of yogurt, different brands, different types, so that we would get into a very difficult scenario if we started looking at cheeses.
Okay. Okay.
We just can't do it.
Next question. Thank you.
Thank you.
Next question is from
Shelley Alexander.
why are you allowed to eat the yellow foods every 4 days if you have shown a sensitivity to these foods? The reason why we do that, Shelley, is that those foods are essentially a mild or equivocal reaction. They're right on the cusp of reactive and non-reactive. We tell the patients to avoid those foods if possible. They're included in the rotation diet to sort of round out the rotation diet and give a patient more dietary options. Ultimately, if compliance was not an issue, we would ask the patient to remove those foods. But we really are focusing on the red foods and the orange foods as the real problems in a patient's diet. The things that are equivocal or on the cusp, we're really going to ask them to avoid them if it's at all possible. We understand that it's not easy. We understand that always can't be done. If you want to eat out in a restaurant, if you want to eat at a friend's house, at a social gathering, it becomes harder and harder to comply with the diet. So we include these in the rotation diet because they're equivocal and because we want the patients to have more dietary options.
If there's a given patient that I'm talking to or talking to their provider about, and it seems that they're in such distress, I will recommend that if possible that the mild reactive foods be stay away from those for as long as possible, unless it becomes too difficult to get food into the person, because there is some obviously they are reactive at some level. So there are times that I recommend that the people avoid even the yellow foods. But that's something that's why we got to the 1 in 4 or 5 days. So you have to sort of use your best judgment on that.
Thanks, Jim. The next question comes, and it says, if someone tests with a high IgG levels, say to dairy, will it test positive on the ALCAT test? It should, assuming that there is a cellular reaction to dairy. We are not measuring IgG levels, so we do not know when we get that blood sample whether there are high titer levels to immunoglobulin G. We are not measuring that. We do not measure the exposure to dairy. What we're looking for is a cellular reaction. So if it shares that same trait as a high antibody level as well as a cellular reaction, then the answer is yes. And that sort of leads us into the next question, which is how does one explain a positive IgG and a negative ALCAT to a specific food? Again, a positive IgG means that you've exposed yourself to that food and you have high titer levels of immunoglobulin G. That does not necessarily mean that you will have a positive reaction on ALCAT. You could be looking at a false positive on an IgG test. What you could be looking at is an overexposure resulting in high titer levels of IgG. That does not necessarily correspond to a cellular reaction. The two things are totally separate and independent of each other. And if anybody, whoever asked that question, if you'd like more information on that, please call Dr. Blum or I offline, and we'll be happy to tackle the ALCAT IgG in greater detail. Okay, next question. The full panels are very expensive. What's the minimal panel you can do and expect significant clinical improvement if the patient follows the results? Dr. Blum, you want to?
I recommend in the minimalist approach at least 150 foods done at that level, because at that point you can make up, you look at what are the most reactive foods from the most common foods that we have, and you probably can get a menu plan out of 150 foods. In the ideal setting, it would be 200 foods, but 150 is the sort of the bare minimum at which you can take an adult through an elimination diet.
It's very important to test not just the foods you're eating, but as we've learned tonight, the foods that you aren't eating. Because if we have to modify a patient's diet, they may be eating some things that they're not currently eating on a daily basis. And the example I like to use is cow's milk. We test for cow's milk, sheep's milk, goat's milk, almond, and soy. The reason why, even if you don't eat sheep's milk, goat's milk, or almond milk, or rice milk, if you can no longer have cow's milk, these become viable options for you or replacement foods. So it's really, for compliance purposes, the best case scenario to test for as wide a screen as possible. You'll see better results in the end, and you'll see better compliance.
Yeah, I want to stress what Lee just said. Compliance is the key to success with this program. If, unfortunately, Americans are all too used to a diet, if they're going to do a diet program and they decide that they're going to limit certain calorie restrictions or certain types of foods, they feel that if they get into an exercise program and do an extra mile on the treadmill or swim an extra 10 laps, they can have that brownie that night. And that's not the case with the elimination diet. If you are reactive to gluten, then you just can't have it. And getting that through to your patients can be the hardest thing going. And so compliance with the elimination program is key to success, because remember, the immune system has a memory. So one of the reasons that it takes so long for this to be totally effective is that the immune system has a memory. Those cells that have a memory to certain reactive foods need to die off, which is around, an average of 90 days. So those whole immune system has to undergo a change, which is why we see a whole shift in foods that are, as you go through the elimination program. The reason that we created the compliance program with the nutritionists is to help your patients go through this very tough period. Next question, Dan.
Martin, hope that answered your question there.
No, I appreciate that. Thank you.
Thank you. Okay, the next question is, how often do you, this is a great question, how often do you recommend retesting? Only upon new symptoms? No, we recommend retesting after the patient goes through the process of elimination and reintroduction. What we'd like to see, and that typically takes 9 to 12 months after testing, what we'd like to see is a patient with a healthy gut reintroduce their reactive foods, and many times what we'll see in that situation is a lessening of the reaction. We'll see foods jump from red to yellow or from orange to non-reactive. So again, like I said earlier, many times foods can be tolerated in a healthy gut as opposed to an unhealthy gut. And that retest many times is the confirmation that the ALCAT program was or was not successful. If you see a reduction in severity of reaction, you've seen a successful program. You've seen a healing in the gut. So we think everyone should be retested 9 to 12 months after their initial test. And in response to that, we now offer what's called a reactive foods retest. So if you tested your patient with our 150 food panel, you can come back to us 9 to 12 months later and say, I'd like to do a reactive foods retest on this patient, and we will take that patient's red and orange foods and retest just their red and orange foods for you to see if we were able to lessen the severity of many of those reactions. I hope that answers the question. Sarah?
It does.
Thank you, Sarah.
Is there somewhere where we can find the cost of that? Is that in our binder?
The reactive foods retest, Sarah, is $99. And it's $99 is our professional fee. That's what our cost to you is. What you charge your patients is really up to you. And that's $99 regardless of whether or not they have 5, 10, 15, or 20 reactive foods. So it's a blanket price, and it's $99 for the practitioner.
Okay, great, thanks.
And it's called our reactive foods retest, and you'll find it on your requisition form. And I think we have one more question. Oats are not considered to have gluten in some sources. Is that wrong?
Technically speaking, oats do not have gluten. However, in this country, the way that food is processed is that oats get contaminated with the belt lines where there is from wheat and from other gluten products, so that unfortunately gluten is contaminated. Oats are contaminated with gluten. So if you can find a source of oats that are not run with wheat and are truly gluten-free, you can have gluten-free oats.
Okay, part 2. Please discuss Candida sensitivity. You want to handle that now, or you want to handle that? Okay. Sometimes we get a saliva positive. What is that? Saliva positive secretory IgA to gluten, but negative to ALCAT. Can you say why?
Sure. The ALCAT test is not one of the standard tests just for gluten and celiac. So we are not saying that we are a celiac type test. So that's sometimes why we don't see a match on a one-to-one basis.
Okay. Folks, we're coming to the end of our webinar presentation right now. Does everyone have our contact information for additional offline questions that can be taken tomorrow or at any time in the future, our phone and our emails?
Unmuted.
Yes.
I had one last thing.
Who is that? Who had a question for us?
It's Shelley. I put it on there. I was wondering if you have a red or orange sensitivity to certain foods, do you also have to avoid them in hair or skincare products?
Absolutely. Absolutely. These sensitivities are avoiding everything that contains these items, whether it be your foods, your skincare, your hair care, your supplements, anything you're doing. Absolutely. The answer is yes, without a doubt.
Thank you so much.
You're very, very welcome. Folks, it was a pleasure having all of you in the meeting tonight. I hope this was helpful to everyone. Again, I'm available. Dr. Blum is available at any time, and our contact information is on the screen for you right now. We'll be doing a very similar webinar to this at least once a month moving forward. So if you or any of your colleagues would like to attend again or at a later date, we'd be pleased to have you. Enjoy your night, and thank you all once again for your support.